Well, of course, we're all waiting for more information about what this new variant is going to do in our hospitals, how it will affect transmission. Early data is suggesting that the Omicron variant is not causing severe illness as much as previous waves. The Netcare hospital group says it is currently seeing milder symptoms in COVID-19 patients. That's at the moment. We've got to put that caution in. A few days ago, they're saying around 90% of their COVID patients were not even on oxygen. So, yeah, we have seen some positive early data coming from our hospitals. We've also heard some lab results today that confirm breakthrough infections are very likely, but positive news as well that the other elements of the vaccine or your immunity can help fight off a breakthrough infection. But let's hear from Dr. Richard Friedland, CEO of the country's biggest hospital group, Netcare. Doc, thanks so much for your time. And of course, the news this evening from the SA Health Products Regulator that they have now approved a booster dose of Pfizer for adults over 18 who had their second dose 6 months ago, and also for children over 12 who are immunocompromised and who had a first dose of Pfizer. We are seeing countries pushing the boosters around concerns on Omicron. Do you see this as an important step that SAHPRA has taken today?
Sally, it's an absolutely outstanding decision that will be very widely welcomed. And I think it's outstanding news. And we all know the importance of vaccination. It's our first line of defense besides the non-pharmaceutical measures. Obviously, wearing masks is critical. It's an airborne transmitted disease, but vaccinations are critical, and I can't applaud the decision more. It's outstanding.
You wrote last week and again today that you were hopeful about a silver lining, that with the high number of cases from Omicron that we are seeing, there have been fewer hospital admissions. But of course, it really is early days. And I want to ask you, what is the picture that is emerging from your hospital admissions regarding COVID at this point?
Yeah, thank you, Sally. It is very early days, and we need to emphasize that the data that we published today is only 3.5 weeks of data since this variant was discovered in South Africa. And so it is far too early to make any firm conclusions, but it's very encouraging, the data and the clinical cases that we are seeing at the moment. Most of the people we are seeing are having a mild or moderate form of COVID-19 and not the severe form that requires hospitalization and that may lead to death. And so what we're seeing is patients present with mild to moderate flu-like symptoms, a scratchy or sore throat, a headache, or a runny or blocked nose. And we've seen far fewer admissions into our hospitals than we did in the first 3 waves. Now, it is early days, but I can tell you that we only have, as of today, 337 patients who are COVID positive in our hospital. And the vast majority have very mild symptoms. Most importantly, only 10% of these patients require oxygen or some form of oxygen therapy. And that contrasts to 100% of patients that we admitted during the first, the second, and the third wave who were very sick and all required oxygen therapy. And so we're really defining this cohort of patients, 90% of those we have in hospital, as incidental COVID patients. They've come in for other diagnoses. They've come in because they're having a surgical procedure or for an emergency, and we happen to have found that they're COVID positive. And so that's a very, very important sign at the moment.
And of course, you know, we don't know if it is in fact a milder variant. We don't know if it's partly because of the vaccines and natural immunity. And we don't know if it's also because a lot of younger people, that's where it seems Omicron first started. And I guess we're going to just have to wait and see on that one. But you're also quoted as saying it feels different on the ground. I suppose, you know, that's what we've got to go on in many ways at the moment. But the point has been made that this variant has moved so quickly, even if it is actually less severe, our hospitals are still in danger of being overrun because the very vulnerable are still going to end up in hospital. How prepared do you think our hospitals are at this point for that possibility?
Well, I think after 3 waves, both across the public and the private sector, we are all extremely well prepared. But Sally, the indications are is that we're not seeing that level of severity. And when I say it feels different on the ground, when I was in our hospitals in the first 3 waves and seeing and visiting patients, these were patients that were struggling to breathe, that needed oxygen, and without oxygen, they wouldn't have survived. They were desperately ill with COVID pneumonia. As I said, 90% of the patients we have in hospital at the moment need no oxygen at all. They're on room air. All they have is mild upper respiratory tract infections. So very, very different clinical picture. And so I said that if this trend continues, we believe that most of these infections can be treated at a primary care level, with the exception, obviously, of those that are elderly with comorbidities and high risk who may need admission. Just on the issue of vaccination, I can tell you that 75% of the cases we have admitted that are COVID positive are not vaccinated. And we've had 7 deaths of this cohort of patients we've had since the 15th of November, some 800 patients who have died, 4 of which we can attribute to COVID. And 3 of those 4 patients, yes, they all had comorbidities, and they were more elderly, aged 58 to 91, but 3 out of 4 had not been vaccinated. And I think there is clear evidence that there is some protection being afforded by vaccinations.
We are going to get more data as the days and weeks pass. We know that there are hundreds of scientists working across the world on looking at Omicron. But you've pointed to a really important lesson, possibly, from the 1918 Spanish flu pandemic. And eventually, when it sadly had wiped out, I think, between 30 and 50 million people, that virus actually mutated to a less severe strain. Tell us a little bit more about that.
So I think that if you look at history, in the Spanish flu, they also had 3 shocking waves. And then the virus didn't go away. It mutated into a highly transmissible virus that causes the flu that we have today, or the influenza we have today. And I'm not suggesting that's what we're seeing now. You know, we first got to understand if this new variant is robust enough to take over from Delta. But there may well be other variants that come forward and take over from this one. All I'm saying is that these are positive signs, and should this continue, it certainly augurs well in terms of the evolution of COVID. But it's extremely early to draw any conclusions. But one is hopeful, ultimately, we will see a transition of this COVID pandemic, similarly to what we saw over 100 years ago with Spanish flu. But again, just too early to make that kind of prediction at the moment.
Absolutely, and we've got to do all we can to protect ourselves in the meantime. Thank you very much, Netcare CEO Dr. Richard Friedland.